Hi everyone, it's Supriya here for Music Therapy Awareness Month, and I'm joined here with a friend of mine, Allison Reeves.
Hi.
Allison Reeves is a registered psychologist, faculty member in counseling psychology at the University of Victoria. Thank you for joining me.
Thank you for having me.
So I receive referrals for adults and teenagers and children who've experienced trauma. And they want to have music therapy as part of a way of processing their trauma.
Absolutely.
And I asked Allison here to give us her perspective as a registered psychologist on trauma.
Yeah, definitely. So maybe I'll just share a few thoughts about trauma in general. So people experience negative experiences and victimization in their lives. This can be physical violence. They can experience sexual abuse or emotional abuse. It can be through their interpersonal relationships with people who are close to them. So for instance, children who experience trauma in their childhood through a parent or another caregiver or someone else in their lives who sort of cross those boundaries and the children experience a violation. People can also experience trauma through accidents, or illnesses. So for instance, if you're in a serious car accident, if you experience or are part of a natural disaster, those kinds of experiences where you really experience true danger and believe that you're in a great deal of risk. And of course, going back to the piece on children who experience trauma, children can also experience real danger in those situations. And oftentimes there are symptoms that continue on beyond the experiences of trauma.
Right. And carry them on into adulthood.
Right. Absolutely.
So going on that, I recently was working with a client who wanted to process their childhood trauma, being abandoned as a baby. And they came to music therapy and to me to process this deep, heavy laden grief that they were carrying. And talked about it as almost this bad friend that was held on the side.
That was hanging around with them.
Yes, that would be so imposing that seeing sadness on the street, a homeless person would well up tears. And couldn't do daily functioning very well. Because the grief was just so heavy on her as an adult. And for some of those experiences with clients like that, the musical experience from music therapy helped to alleviate and dispose of that ugly friend, as it was called, and say goodbye to the grief. And so what are some other benefits for clients when they process their trauma?
Yeah, so individuals who experience some of the types of traumas that I was just speaking about often go on to have a whole variety of different symptoms. So for instance, they may be sort of troubled or haunted by memories of the traumatic events. They might experience nightmares. They might experience difficulties in the relationships with other people because, again, if they've experienced a trust violation from a close person in their lives, it might become a challenge for them to trust other people. And so there can be many, many impacts on our romantic relationships or on our friendships or family relationships. We might find it hard to connect with people and feel safe within those relationships. And so there's a variety of symptoms that people can experience. And so the benefits of doing some processing work to sort of move through that is, of course, to free yourself of some of the burdens of how that trauma sort of endures or walks alongside you, as you said in the case of your client. So ways that you can sort of repair relationships is another reason why people come into therapy, to work through these traumatic experiences so that they can engage in hopefully some healthy relationships as adults, and also to recover from some of those negative memories that continue to plague them or haunt them on a daily basis. And those everyday triggers, like you said, when you're sometimes just walking down the street and experience a trigger back to your traumatic experience, it can really shake you up and affect you and maybe interfere, as you said, with daily functioning. It can really shake you up, and maybe you won't feel comfortable to sit at your desk and work all day, and that becomes a sort of a distraction from you to work, or, as I said, interferes with your relationships.
Right.
So there's all sorts of reasons why people would benefit from therapy or different therapies to address symptoms of trauma.
Yes. And some of those symptoms, like you said, they can be smaller. It might make for a horrible day at work, or it could be as large as not being able to work and not hold down a job and feel like you're not being able to do the things you'd like to do.
Right, holding you back.
Yeah, holding you back.
From sort of enjoying the fullness of life.
Yes. Yeah. Sometimes what I see in music therapy is the ability of music to act as a very quickly penetrating mirror almost. So it's this nonverbal mirror that shows back to a client how they're feeling. And in music therapy, we call this the ISO principle. It's being in the moment. Instead of saying, you have your grief, let's move past it right now, we sink into the feelings and the emotions of that actual grief, or if it's pain, or if it's loss, if it's loneliness, what is that feeling? And music is a really powerful way to reflect that back to a client. And
sounds like you can really access those deeper emotions pretty effectively.
Yes. And I think, I see that as a music therapist, how a nonverbal technique can be very effective with someone who's processing trauma. What would you say in terms of seeing the positivity of a nonverbal approach?
Yeah, that's a great question. So we know that trauma is not always stored in the brain as a discrete sort of fact-based memory that's tied to clear language. Because of the shock that happens to our bodies and our systems, sometimes those traumatic memories are not so clearly stored. And instead, those memories are stored as sensations or sensory experiences, sight, smell, taste, or as emotional experiences. And so because those memories are not always stored as clear sort of language, in a clear language form, I can see that music therapies would be an effective way to sort of go back and experience and process from that sensory place or from that emotional place, especially when people's, again, their factual memories of the events are not always clear. It's difficult to find the language to talk about those experiences sometimes. And so, as you've said, accessing that experience through these other channels, through music therapy, to access that, again, that sensory experience, the body experience, and of course, all of this sort of, like you said, the emotional sensations that come with music as a conduit for us.
Right. That's a great explanation, and it's really great to hear your perspective and your experience, Allison. So thank you for that.
I'm very happy to share. Yeah, I'm glad to be part of the celebration of music therapy.
Thank you. Well, we appreciate hearing from you and from other professionals that, can weigh in on what the benefits of music therapy might be for someone who wants to use it.
Yeah, very happy to help.
Oh, good. Thank you. So I will say goodbye and happy Music Therapy Awareness Month. Thanks again to Allison, and tune in for another interview soon.